The importance of flu shots, protecting health in a changing landscape. As the seasons shift from warm to cool, the looming threat of influenza, or the flu, begins to emerge, marking the start of the flu season, which typically runs from October to April. With the Centers for Disease Control and Prevention, or CDC, recommending that everyone 6 months of age and older receive an annual flu shot, it is imperative to understand the significance of this vaccination, especially in the context of the ongoing COVID-19 pandemic. This video delves into the flu season, the impact of vaccines, types of flu shots available, and where to receive vaccinations, emphasizing the critical nature of flu shots for individual and public health. Please click on the like button, and also subscribe to my channel for more to come. Understanding the flu season. Flu season is characterized by an increase in influenza cases, which can put significant strain on healthcare systems. The flu virus circulates widely in communities, leading to thousands of hospitalizations and deaths each year. On average, influenza claims 290,000 to 650,000 lives globally annually, a statistic that is alarming, particularly when viewed alongside the challenges posed by the COVID-19 pandemic. The timing of vaccination. The CDC recommends that individuals get vaccinated before flu activity becomes widespread in their communities. It is essential to note that it takes about 2 weeks for the vaccine to build immunity in the body, meaning that timely vaccination is critical. The CDC advises that September and October are the best months for flu shots, allowing individuals to be protected as the flu season peaks. Last year, pandemic precautions, such as social distancing and mask wearing, resulted in a notable decrease in flu cases and deaths. However, as these restrictions are lifted and normalcy returns, public health experts are concerned that flu numbers may rebound to pre-pandemic levels. The interplay between COVID-19 and the flu poses a significant risk to the healthcare system, potentially overwhelming resources and leaving many without essential care. The impact of vaccines. Vaccination against influenza is one of the most effective ways to reduce the risk of flu-related complications and deaths. Experts attribute the previous year's low flu-related mortality and hospitalization rates to a record number of flu vaccinations administered. The surge in flu vaccinations indicates a growing awareness of the importance of preventive measures. Who should get vaccinated? Well, while everyone should get vaccinated, certain groups are at higher risk for serious flu-related complications. Individuals over 65 and children under 5 are particularly vulnerable and should prioritize receiving their flu shots. Additionally, those with underlying health conditions should avoid exposure to infected individuals and ensure they are vaccinated. The role of secondary infections. Most influenza-related deaths result from secondary respiratory tract infections or bacterial infections that arise after the flu virus compromises the immune system. This underscores the importance of vaccination, not just for preventing the flu itself, but also for protecting against these potentially fatal complications. Types of flu shots. The flu virus is not static. It evolves, leading to the emergence of new strains each year. Consequently, flu vaccines are updated annually to match the most common circulating strains, ensuring maximum effectiveness. This year, a preferential recommendation has been made for individuals over 65 to receive a higher dose of an unadjuvanted flu vaccine. Options include Fluzone High-Dose Quadrivalent Vaccine. This vaccine is designed to elicit a stronger immune response in older adults, who may not respond as robustly to standard doses. Flublock Quadrivalent Recombinant Flu Vaccine. This vaccine uses recombinant DNA technology to produce antigens, offering a higher level of protection. Fluad Quadrivalent Adjuvanted Flu Vaccine. This vaccine includes an adjuvant which enhances the body's immune response to the vaccine. For those under 65, there is no preferential recommendation for a specific vaccine type, but they should still receive a flu shot to protect themselves and others. Where to get a flu shot? Access to flu shots is critical to ensuring widespread vaccination coverage. Flu shots are available at various locations in the community, including primary care providers. Many people can receive their flu vaccine during routine checkups or appointments. Local health departments often run vaccination clinics and outreach programs, especially during peak flu season. Many large pharmacy chains, such as Walgreens, CVS, and others, offer flu vaccinations. These locations typically have convenient hours and no appointment necessary, making it easier for individuals to get vaccinated. Various community health organizations may offer flu shots, sometimes at reduced costs or for free to underserved populations. To find a location near you, visit vaccinefinder.org, a helpful resource that lists places offering flu shots in your area. Flu shots and COVID-19. With the emergence of COVID-19, public health guidelines have adapted to ensure that individuals can receive necessary vaccinations safely. The CDC has stated that flu vaccines and COVID-19 vaccines can be administered simultaneously. This flexibility is crucial, allowing individuals to protect themselves from both viruses during a time when they can circulate concurrently. Safety and guidance. The CDC has published interim guidance for immunization services during the COVID-19 pandemic, which outlines safety protocols for healthcare providers to follow while administering vaccines. This guidance is designed to ensure that vaccinations, including flu shots, continue without delay, which is essential for maintaining public health. It is important to emphasize that vaccinations, such as the flu shot, are an integral part of preventive healthcare. Skipping or delaying vaccinations can leave individuals vulnerable to infections that can have serious health consequences. The broader implications of flu vaccination. Vaccination against the flu is not merely an individual health decision, it has broader implications for community health. High vaccination rates contribute to herd immunity, protecting those who cannot be vaccinated, such as infants or individuals with certain medical conditions. When a significant portion of the population is immunized, the spread of the virus is reduced, helping to protect the most vulnerable members of society. Educational outreach. Public health campaigns play a crucial role in increasing awareness and understanding of the importance of flu vaccinations. Initiatives that promote the benefits of getting vaccinated, dispel myths surrounding vaccines, and provide easy access to flu shots are essential for increasing participation. Engaging with communities through educational workshops, social media campaigns, and outreach programs can enhance awareness and motivate individuals to prioritize their health during flu season. Conclusion. As the flu season approaches, the importance of flu vaccinations cannot be overstated. With the added complexities of the COVID-19 pandemic, receiving a flu shot has become even more critical. By understanding the flu season, the impact of vaccines, and where to get vaccinated, individuals can take proactive steps to protect their health and contribute to the well-being of their communities. The CDC's recommendation for annual flu shots for everyone aged 6 months and older is a call to action. By prioritizing vaccination, we can mitigate the risks associated with influenza, protect vulnerable populations, and help prevent the healthcare system from becoming overwhelmed. In conclusion, as we navigate this changing landscape of public health, let us remember that the gift of health is within our reach. The simple act of getting a flu shot can have lasting effects, not just for ourselves, but for our families, friends, and communities. Let's make this flu season a safe and healthy one by prioritizing vaccinations and supporting each other in our health journeys.